recover from the virus still face lingering challenges like breathing problems, brain fog, chronic pain, and fatigue. These conditions can sometimes rise to the level of a disability.
That was President Biden nearly a month ago, suggesting that COVID-19 long haulers should have access to rights, resources, and protections of the American Disabilities Act. Now, the National Institutes of Health is currently researching the virus and its long-term impact. Early data shows that up to 30% of patients who have recovered from COVID may experience longer-term health impairments. So joining us now to break that all down, Dr. Kevin Sneed of USF Health, along with his patient, Ronald Montgomery. Montgomery is a long hauler. And, well, we're still working on both of them. Mr. Montgomery, thank you for joining us. It's a pleasure to have you. We definitely want to talk more about just the simple fact that we're seeing cases surge. Here we are thinking that it was a summer of freedom. Unfortunately, we're seeing cases, seeing the cases rise to pre-vaccine numbers. Okay, we got you both. Thank you, Ronald, for joining us. It is a pleasure. I thank you for your bravery, and I hope that we can touch some lives out there. So, sir, briefly tell us how bad it was for you after you were diagnosed with COVID.
It was bad in the fact that when I was diagnosed with COVID, I was asymptomatic, meaning that I didn't have many symptoms. I had mild symptoms, but it was after I tested negative, that's when the symptoms really came down hard.
And can you just briefly tell us what some of those symptoms were?
Some of the symptoms was vertigo, fatigue, dizziness, joint pain, loss of taste, memory loss. There's a host of other things that happened. I can't quite remember all that happened, but I had about 20 symptoms in all.
Wow. Dr. Sneed, I know that Ronald said he couldn't remember. Do you believe that could possibly be part of what these long haulers are experiencing? And can you just kind of tell our audience members what those symptoms consist of?
Absolutely. I think Mr. Montgomery, first of all, I want to thank him for having the bravery to come on and really just share his story with us. You know, some of the things that he experienced were really the first time that I had ever heard of anyone having these symptoms and experienced it. And we do know that 1 out of 3 people that winds up becoming infected can have long hauler symptoms, and much of what he already described: the brain fog, persistent coughing, memory loss, anxiety, mood disorders, joint pain, muscle pain. There's a whole host of things depending on which organ has been affected. There are people that have long, persistent problems with their heart and irregular heartbeats. And so we've experienced all of that. He's one of the people that was really the first to really share what was happening with him, even before we had the term long haulers. And so we thought it was very important to begin to share that story with many people because, as I have mentioned before, I'm very concerned that we may be walking ourselves into a calamity later on this year with the number of people that are being infected right now.
Absolutely. And Mr. Montgomery, when were you diagnosed with COVID?
I was diagnosed May 9. I was tested on May the 7th of 2020, and when the results came out on May the 9th, it was shown that I had tested positive for COVID-19.
And here we are a full year plus later. What are you still experiencing right now?
Right now, I'm dealing with sinuses, chest congestion, which the doctor says bronchitis, and I haven't had bronchitis since 2005. Also, I'm dealing with my fingers and my toes get extremely hot, and then they get extremely cold. Also, I'm dealing with the brain fog again, and the dizziness.
And it looks like the emblem on your shirt is for a firehouse. Are you a firefighter, sir? And if so, can you tell us how this has impacted your life?
Actually, this is I call it my pajama shirt. I was in the fire service for 31 years, helping to train future firefighters through a program called the Tampa Fire Rescue Explorers.
What do you want to say to people who are, for one, they think that this is a hoax, and two, they are refusing to get vaccinated?
By all means, it's not a hoax. It's not a hoax because to tell you the truth, I want to tell you the honest truth. I felt like I died 4 times with this. My heart rate went down, my breathing went down, and I tell you, it's like I was begging for my life. And that happened to me approximately 4 times that I could think of. And I can tell you, it is no joke, no hoax.
So, Mr. Montgomery, when you hear lawmakers playing politics with this virus, and here you are a year plus later, still dealing with the ramifications of it, how does that make you feel?
It makes me feel sad because they're not taking it serious. And as you know, the president who always, former president that always called it a hoax, ended up in the same predicament, where he was transported to a hospital. Let's just say he was transported to the hospital, and I was told not to come to the hospital unless I needed a ventilator.
So, Dr. Sneed, are there any misconceptions about who is at risk of becoming a long hauler? Because anyone could become Mr. Montgomery, anyone that becomes infected, including myself.
Yes, I think right now many young people feel that they're invincible and cannot actually succumb to the symptoms of being a long hauler or having the post-acute COVID symptoms. And therefore, we haven't seen the behaviors that would indicate that they're taking it serious and trying to mitigate wear a mask indoors and going out and getting vaccinated. There are other people that continue to believe that coronavirus, that the SARS-CoV-2 virus, does not exist and cannot cause this problem. But we are seeing multiple people that have the very same long haul symptoms. But number one, we cannot predict who's going to have that. And number two, right now, we know that we have a solution that can help prevent that by getting people vaccinated. And so, one thing that Mr. Montgomery did not mention that he shared with me during another encounter was that even though he had been infected before, we did encourage him to go get vaccinated. And even though he didn't have complete resolution of symptoms, he did indicate that they improved after he got vaccinated. And that was very fascinating for us. And again, back in May of last year, we didn't even have the term long haulers at that point. So he's really one of our first people to really kind of help teach and train us as providers what can and what's possible, even from the standpoint of getting vaccinated after you've been infected, which another thing we encourage through the CDC. So I hope that kind of answers the question. But once again, I just wanted to make sure that everybody knows that we can prevent this from happening. But we are never going to abandon Mr. Montgomery. We're going to be here for him the entire time. We're going to help everybody we can. But we can help many of our healthcare providers by going out and getting vaccinated and not winding up in the hospital.
Yeah. Mr. Montgomery, what do you want to say to our viewers at home? Because again, there are just so many myths surrounding this virus, this vaccine. I've heard people say Black people can't get it, or, that's never going to happen to me, or the vaccine is tracking us. Just silly things, to say the least. What do you want to say to get someone right now, today, to roll up their sleeve and get vaccinated who may possibly be on the fence?
Let me first start off saying that tomorrow is not promised to anybody. And today, while you can, you want to go. Well, first start off, you want to protect yourself by wearing the proper protective equipment. And second of all, you want to go and get vaccinated. and not take this lightly because, like I say, a lot of people have died saying they wish they had a got the shot sooner, but that's a little bit too late now. But today is the time to go and get vaccinated and not play around with this because it's just going to continue to get worse as our schools are now taking in and as the stadiums going to start getting filled with sport spectators. I do look for numbers to elevate pretty rapidly with all this going on. But having said all that, wearing a mask, getting the vaccine, you can't lose. But you can try to help yourself by doing these things. By not doing these things, you're taking a serious risk. And this is not a play toy, something that you can play around with. Because as I have stated, I felt like I died 4 times having this disease.
Have you been able to return to work, Mr. Montgomery?
I have been working, but as I'm working, I'm continuing fighting through the the fatigue, the dizziness, the extremity, um, fingers and toes getting hot and cold. So I'm still fighting. I'm still fighting.
Yeah, we're still here. Even though that light went out, we are still here. And we really, truly appreciate your bravery. My last question, I know Dr. Sneed touched on this, but just in your own words, tell us what happened after you were vaccinated.
After I got vaccinated, um, on December the 23rd was the first dose of the Moderna vaccine that I had. I was extremely fatigued, dizziness set in. I was dealing with the dizziness and the fatigue. And then later on, as later on as the months went on, then certain other symptoms started to creep in, and it was only the symptoms that I had dealt with in the past, meaning the severe chest pains and the shortness of breath, and here and now, here and then, brain fog. But all the other symptoms I wasn't dealing with, but just the symptoms that I just described, for some reason, they're hanging on. I don't know why, but they're still hanging on, and this is what I have to fight through every day when I'm at work. The symptoms that I just described.
Yeah.
That's why I continue to seek Dr. Snead and the University of South Florida. You know, because this has caused me to like reach out and reach beyond the break to try to say, is there anything that I could possibly do, you could possibly do? And so far, we're continuing this endeavor to try to come up with some kind of solution to the problem. But it's slow going, and like Dr. Sneed said, it's in the early stages, and we just keep moving forward.
Yeah, absolutely. So you received a little bit of relief after that vaccination shot, but the symptoms you experienced were still what you were previously dealing with, unrelated to the vaccine. I just want to make that clear to our
I,
audience.
I'm gonna put it to you like this: it's like a hurricane. It's over land. You have some relief, but then after a while, it keeps turning till it get back over open waters. And when it get back over open waters, everything come crashing down on you. Like I said, I just recently got bronchitis, sinuses, and along with the other symptoms that I've been dealing with. So that's what I'm alluding it to. Is like a hurricane. It moved over land and everything is subsided, but it's still
Yeah.
raining and what have you. And then for some reason it just keeps turning till it get back out over open waters, regaining strength. And then once it do that, the symptoms come crashing down on you again. Now it's like I don't want to eat now. that's just another thing there. You know, it's like I was eating good last week, and now here this week I'm forcing myself to eat because I know I have to do that to keep my strength up. But that's
Absolutely.
how I, allude this to. It's like a hurricane. It goes over land. It doesn't, fade away, but then it goes back over open water, pick up something else, and then come back at you again.
Mr. Montgomery, I wish we had more time. Again, we here at BNC, we really appreciate your bravery for speaking out. For anyone joining us, Mr. Montgomery is considered a long hauler. He was diagnosed with COVID last year, and he's still experiencing symptoms a year and some change later. Dr. Sneed, thank you so much for joining us. We really appreciate both of you men. And Mr. Montgomery, best of luck, sir.
Thank you.
And we'll be right back after this short break.